So what do I do with a patient who comes to me and is experiencing classical venous symptoms, heaviness, aching, cramping, discomfort, bulging veins in the legs? First thing I'm going to do is an ultrasound. I want to see what those veins that are deeper and larger in the leg look like. If I can see that those veins are not working properly, then I can come up with a treatment plan. First thing I do for every patient is I put them into compression stockings. Those compression stockings are going to help to alleviate the discomfort, and the patient will be able to go about their life and be more comfortable. Compression stockings are only one of the things that we can do in the scheme of what we call conservative management. Conservative management also consists of leg elevation, motion of the leg, exercise. These together will make up conservative management, and they will make patients feel generally a lot more comfortable. After several weeks, I'll have the patient come back. If they are comfortable with conservative management, we just continue that indefinitely. If it makes them happy, if they're feeling good, that's where we want to go. If they are uncomfortable, or if they don't like the way the compression stockings feel, they can't anticipate wearing them endlessly, then we shift gears into doing a procedure to help close those veins. The primary procedure that I perform in my practice is a procedure called endovenous laser therapy. Scary sounding term, but basically all it means is that we insert a very thin laser fiber into the vein that's malfunctioning, and we use the heat from the laser to close the vein top to bottom. This is all done in the office. It's a very minimally invasive procedure. We generally don't need to give much in the way of anesthesia, just some local anesthesia to make the patient feel comfortable, potentially a little bit of oral sedation, but we don't need to knock the patient out. We don't need to have them go to sleep or anything like that. We don't need to do this in the hospital. There's no cutting involved. There's no stitching involved. It's in and out within 2 hours, and the patient generally will have a very quick recovery time of less than a week. I have patients on their feet the very same day. I want them up and about, walking around, and they go back to work the very next day. They may have a wrapping on the leg to just keep everything compressed, but they're able to go about their normal activity. We ask patients to refrain from extreme strenuous exercise, lifting very heavy objects. Otherwise, they're free to go about their normal life.